I'm a pediatrician by training. I'm the head of Department of Pediatrics and Child Health at the University of Cape Town, and the head of Department of Pediatrics at the Red Cross War Memorial Children's Hospital. But my research work is in vaccines and vaccinology. I sit in the what is called the National Advisory Group for Immunization, which is the group that advises the Minister of Health on vaccines in general. But I'm also a member of the working stream that looks at COVID vaccine safety and effectiveness that is used to inform the Ministerial Advisory Committee for COVID vaccines. We call it the VMAC. So that's what I'm doing right now as far as COVID vaccines are concerned. So, yep. I've had a number of talks with some staff members in other organizations, and I've had one for Dyser School as well previously. But most of my stuff has been in scientific cycles kind of thing. But I hope I can speak in normal language for those of you who don't do a lot of medical stuff. I've actually done a number of radio talks for children's program in Chivenda, for example, which is much more harder than doing it in English. So, but please just jump in if there's anything you don't understand when I'm giving this short, trying to make this thing move. So, a number of us probably don't realize this, that pandemics have been with us since time in memoriam. And in fact, there are some who even claim that this is not the worst of the pandemics. And one of the reasons is got something to do with the hope that vaccines actually gave in this space. This is coming from the First World War and the First World War flu pandemic, where you can see like stretches and stretches, and you can see people have got masks. Just like now, a number of people have got masks on their chins. They don't work very well that way, but hey, you see them all the time in shopping malls, man, and at the waterfront. But you can see that there are all these masks, and you can put them in your chin too. But that's basically been the case, and we've had a number of them before. And I mean, they go very far back. You can see this is from the plague, the bubonic plague, for example. People don't realize that the plague gave us the word quarantine, which means 40 in Italian, because when ships arrived at the harbor, they were made to dock there for 40 days so that everyone with the plague would either die or would have survived enough no longer to be infectious. And that's where we got the word quarantine from, which is this way of keeping people away for 40 days until they were a bit safer. And even children during the First World War had all these masks. It's coming from the First World War. So you will ask what the game changer has been. We don't realize that for most of mankind's history, the life expectancy has been very, very poor. I mean, people, if you live to like 30, you were like an old man or an old woman. But the game changers over the last 300 years, 500 years, where there was quite a marked increase. So this is just like less than 0.1% of the time that human beings have existed. If you look at American data, for example, you can see that in the early 1900s, the life expectancy was like mid-40s, but now it's like up to 80. People don't realize why, but that's, if you look at that yellow bar there, these are deaths in 1900 that were due to infectious diseases, but they make a very small fraction 100 years later. And the largest impact of that has been done due to vaccines. People have never heard about diphtheria, for example, which is a disease that used to kill like tens of thousands or millions of people in the world. Almost 50,000, more than 50,000 Germans died of diphtheria alone during that time period. But now, if you ask anybody here if they've ever heard of diphtheria, they will say like, oh, they don't know much about it. I mean, we've had sporadic cases now, but the major reason for that has been this: vaccines. Vaccines have really made a huge difference. Most of them that we have, we usually give them to children And that's why we always think about vaccinations in this space here as children. But they're actually now throughout the whole of life, from before a baby is born. A mother who gets that tetanus shot is to protect both the mother at birth and the newborn baby. But there are others that you need to give in adolescence, like HPV to protect against cervical cancer later. What we also know is that adults do need like flu vaccines all the time, and when we went to medical school, we had to get the hepatitis B vaccine because some of us had not gotten that as a baby. That will help a lot with respect to getting hepatitis B that causes liver cancer, for example. So some of these are virtually vaccines against getting cancer. And then but later on, the elderly, things like flu vaccines again, but there are a whole lot of other vaccines that are under development. A number of them are actually anti-cancer vaccines that people are working on because it allows your immune system to be able to identify the cancer cells and get rid of them. So there's a lot of stuff that is actually happening with respect to vaccines. So right now, as we see it, you can see how the march has been over the years. You know, from where we had only had smallpox vaccines, by 74 we had like these are for vaccines against 6 diseases. This is diphtheria, tetanus, pertussis, then polio, measles, and BCG for TB. That's what we used to have in 74 when this was launched. But now we've had others like mumps, measles, rubella, Haemophilus influenza that causes meningitis and pneumonia, and hepatitis B, obviously. And more have come in, rotavirus for the diarrhea that now we have for children. When I was a registrar in the early 2000s at Red Cross, you used to literally during the summer months get like 90 babies every day in the diarrheal ward. And I used to actually, like most of my colleagues, go to work before 7 so that I could just start working. And I would leave at 7 without having gone to lunch, just clearing those kids. I mean, the space, I can tell you now, it's designed to hold like 32 kids, but we used to have like 90. And when you finish at the end of the day, there were as many children as you started with. There were just different ones because whomever you got rid of, someone replaced them immediately. And the game changer was the rotavirus vaccine that basically just completely changed that when it was introduced in 2009. And now we've got more of these vaccines. So when we're talking about the coronavirus vaccine, we're basically talking about the same concept of where we were. It's something that we have had for the last 300 years, starting with smallpox. And all what has changed, and I'll talk about it briefly, it's the technology involved in getting this done. So just using the coronavirus as an example, all that happens with vaccination, it's simply a way of training the body, as you all very well know by now, to be able to identify the infection when it comes and being prepared to fight it in many ways. So that's basically that. And so all that happens is that there are certain things that the normal human body fighting infection will target. And part of that is this surface, which means it can latch on that, sending antibodies to mop all these viruses. And if they do escape and get into the cells, the body produces cells that can kill that virus. All you do is by getting a part of the virus is to get the body to identify that. I mean, I would basically almost compare this to sort of target practice. So you get the body to know what the target is, learns safely to fight that target, so that when the real thing comes up, the body really now knows how to fight that infection because it's been trained to do so. And what then means is that the body is able to do that much more quickly. So what happens is that if you look at how it works first, when you get an infection for the first time, it could be natural infection or it could be just the target practice I'm talking about, that the body responds to produce antibodies and whatever else it is. But you can see it takes a bit of time to reach that level. It's not that high, but it reaches some kind of a peak. But the second time the body is exposed to that, the response is quite rapid. You can see it's much quicker. and therefore you don't really get infection. So usually, and I'll come back to it later to just make you understand a few things, is that by the body able to respond much quicker this time, the second time around, it means the infection never really takes root, which is important. So, and in the rare circumstances that it takes root, it's cleared much quicker than would otherwise have happened had the body not known how to fight that infection. That's all we do with all the vaccines we give to children. That is basically the principle underlying this. Now, what has happened with COVID vaccines is that there have been many methods. I mean, I didn't put another slide here. By June last year, there were about more than 250 vaccine candidates. The ones that we talk about, which is the AstraZeneca, this is the first one we registered but never used. The Pfizer one, which is what we're rolling out now. And the Sputnik that the EFF were campaigning for it to be registered. Are the ones that were pretty much in the forefront when it came to these vaccines being developed. They are very different technologies. The Pfizer one, the technology is what they call a messenger RNA. I mean, those of you who have done biology or remember some of your biology will remember what happens here is that the body, to produce anything it does, it uses its own DNA. Which is almost like a big recipe book. So it takes a part of that recipe, it converts it into an information for how to produce whatever it produces. That's how the body produces saliva. That's how the body produces tears or stomach juices. It is the cells do that by reading the DNA. So what has happened with these vaccines? I told you before that what we want to do is to get the body to respond to this spike protein by making it a target for learning how to fight the infection. Now, what happened to the Pfizer vaccine is that the body is given the recipe of making the target. It's not the DNA, it doesn't have anything to do with the human DNA itself. It's just that in the same way you produce saliva, you give the body a recipe of how to produce saliva. And so what you do with this, you give the body a recipe on how to produce the target. Then it learns to fight that target, which is how it builds immunity for the next vaccine, for the real coronavirus when it comes. The Gamaleya, which is the same method, and the AstraZeneca has the same method as the Johnson, which is in this second page here. These were the second ones that came through. What it does here is that instead you've got the surface with this protein put in directly so that the body learns how to fight that. So it is basically that instead of the body making that target itself, you give the body the target so that it learns how to fight that. And so there have been a number of these vaccines that work in that same way, but the underlying principle is really the same. To produce immunity, you need to identify what you're fighting against. By learning it, by using something that does not cause infection itself. None of these are like real live viruses at all. It's just part of that the body learns to fight against. And then, but using very different technologies. As I say, these are the different technologies that you can see: inactivated, protein subunit, non-replicating viral vector. These are like different kind of technologies used to do so. And for the two vaccines that we have, we know that the doses to achieve that are slightly different. You'll probably realize too, when you take a baby to for their own shots, that they get one at 6 weeks and at 10 weeks and 14 weeks. A number of those is the same thing, but it means with every dose that you give, the body builds up that immunity and its response is better and better. With the Johnson, the effect that is protective was felt to be sufficient with one shot. That's basically why you use that one shot. For the Pfizer, it seems to be lower. And once you give another shot, it goes higher, giving you the same protection. It's slightly higher than what you get with Johnson & Johnson, but it's nonetheless there, if that makes sense. And so there are these different kind of vaccines that you get with respect to that. Now, to just give you quick understanding, which is why this is important in how people feel, and what you'll also hear about stories about, oh, but this happened and this didn't work very well in this person or that person, is because when you give a vaccine, there are a number of things you achieve with that vaccine. The very first one I mentioned is, which I talked about, those antibodies you see are generally designed to mop up the infection even before it takes root when you get it. So you kind of prevent infection completely. When we give the measles vaccine. That is the main reason you give it. You give that measles vaccine so that someone doesn't get infected at all. That means even if they come across someone with measles, they never ever know that they came across someone with measles because the infection was cleared before it even takes root, right? But there are some vaccines that when you give them, you prevent disease, but are not very good in preventing infection itself. The tetanus shot that you get, you're working in your garden, you cut yourself and you rush to the hospital. It doesn't protect you against infection. The bacteria that causes tetanus still gets into the body, but because it produces these toxins that cause disease, the vaccine targets those toxins, mops them out, so you never get the tetanus disease, but the infection is there. But we hope with most of these vaccines that you'll achieve this third thing, which is to reduce transmission. If you're going to prevent infection from taking root, it means that people don't get infected. And if they don't get infected, they can't pass it to the next person. And if you vaccinate enough people, it means then the infection has got nowhere to go because people are not getting infected because they're protected. When you reach enough people protected, you call it herd immunity. That's what people have been talking about. So herd immunity is that where even if people are not, some people are not vaccinated, if you vaccinate enough people, the disease dies away because there's just no one left that it can infect. And that's why getting as many people vaccinated as possible makes a big difference. That's how we got rid of smallpox. We vaccinated everyone and the virus could find no one and the virus is dead. There was no one left in the world that it could infect. This is the target also for polio. We're trying to do the same thing with polio. Vaccinate enough people. The polio virus, because it's only found in human beings, you can't find anyone, then there's nowhere else for the virus to go, then it will die. The measles, the same thing. We're hoping to be able to do things like that with that. So there are these diseases that are targeted. Now, sometimes the vaccine, and this is where we are with COVID vaccines, which is why it's probably key, is that sometimes the vaccines are not fully effective in doing that, in preventing full transmission, in preventing full infection. But what they always do is to prevent severe forms of disease. So if you look at, for example, TB, we've got the highest TB burden in the whole world, in this city, in Cape Town. But we've got that vaccine, the BCG that you get as a child. You'll ask, why does it matter if you do that? But if you didn't get that BCG, most children would get TB meningitis. They will get TB throughout their whole body. But the vaccine, even though it doesn't prevent them from having some TB in the lungs at times, it does prevent from getting severe forms of disease. And so when you look at COVID vaccines, they're all having these different levels of efficacy. You realize, one, that the vaccine does not 100% protect against any infection. So people who have been given the vaccine, some of them will tell you that they got a bit ill, they got like a runny nose, a bit of fever, but it prevents people from ending up in hospital and people dying. And that's key. I mean, there's a very good chance that the current vaccines we have will need to be tweaked because these were done as first generation. And so the things that we are learning during the course of disease are being built up into the mechanism of tweaking and improving all these vaccines, including how to deal with new variants that are coming up, including starting to understand, will the immunity you get wane and need to be boosted? We really don't have full answers to these questions. We know that with the number of vaccines, that the further away you move from your last dose, your body starts forgetting how to fight the infection, and boosters are helpful to actually achieve that in doing so. So there are a number of these questions. So this at a public health level, the more people you vaccinate, you can reduce disease in the population. You can eliminate it, and if you can completely eradicate the disease from the existence, like we did with smallpox. So, right. So I know that the questions people are asking is, do these vaccines not have side effects? Of course, they've got side effects. Virtually everything you have in life seems to have side effects when you take it. The question is the balance of whether the severity or mildness of side effects are acceptable for what you get. People don't realize this, that when you take Panadol, that it is not without side effects. And it's only when you see a child that has had Panadol reaction and they've got liver failure and they need a liver transplant, that you realize that Panado is not the benign stuff that you pick up a shelf at Pick and Pay, because we've seen these kind of things happen. But you take the Panado when you've got a headache, because the risk of that severe reaction happening is much unlikely than you getting a headache. So a number of the side effects that you get from these vaccines is actually proof that the vaccine is actually working. So what you get is that all this, most of the thing that you get is the things that are local, where you've been injected. Obviously, if I put a needle through your arm, you may feel pain and there may be some slight swelling around that and a bit of redness. And then you get all these things like tiredness, headache, muscle pain, fever, and so forth. The reason why this happens quite often is the same reaction that you'll get if you get an infection. Because your body responds with an immune response, part of that response gives you all these side effects. When you get flu, or you get malaria, or you get anything else, the reason why you look sick at times is not just the virus causing that, it's your body responding to that virus. And that response is your immune system kicking in to clear that virus. Because the body is responding, this is almost like you've got your target practice and you're trying to shoot at it. And of course, you're going to find holes around your target and stuff like that, because you're trying to shoot at that target. And that's basically what happens. So most of the side effects that you get with all these vaccines are evidence that you are actually responding to what you're given in order to build that immunity. So this is your body's response to that. There have been reports of severe side effects, things like anaphylaxis, which is like severe allergic reaction. People may be allergic to something within the vaccine, and that's why people, when they're given the vaccine, they're asked to wait for like 30 minutes to just see that they're okay. And that's because there are ways of dealing with those side effects when and if they do okay. But those are very rare. I mean, right now we know that millions and millions of people have been vaccinated. In the US, I think Joe Biden's administration managed to give 100 million doses in the first 40 odd days of the current administration. And we know all over the world that these vaccines have been used. Pfizer, actually, which is the most used, has been used by so many people in the world. I think up to date, more than 3 billion people in the world have been now vaccinated. So we now have quite ample evidence of the degree of side effects that are there and how severe and how common they are. And so compared to all the vaccines we've used in childhood, the current evidence shows that these vaccines are quite safe and effective in terms of doing what they should be doing. The most important one, which is to protect against severe disease and infection. So that's basically that. So just last 2 slides. Generally speaking, when you produce vaccines, and this is the same for a number of pharmaceutical drugs, it takes ages. It takes years to produce a vaccine. It actually takes like 10, 15 years to produce a vaccine, because you've got this area where you're exploring things, where you find out which part of the virus you need. Do you need this? Do you need that? Do you need that? That is the first part that you will first have to worry about. You need to explore any and all of that. Then you find out, you do all the safety things to see if things in animals, to see how the vaccine, how the body responds. Then you go to the phase 1. In phase 1, you only get young men or young healthy men to give that vaccine to. You don't give it to women because you don't know what the impact will be on fertility and so forth. You don't give it to children because you don't know how they respond. These are very few volunteers where safety work is done. You can see what reactions you get, and then you go to phase 2. And in phase 2, you try to figure out which dose is the right one to produce the immunity that you believe will be good enough to protect. And then once you found that dose, you then move to phase 3, where you then give the vaccine to half the people. You give them the vaccine, half you give them nothing, like what we call a placebo, and see if there's any difference between the group you give the vaccine to and the ones you don't give the vaccine to. But combine all these things as you do, you give them, you take ages and ages to reach a conclusive answer that something actually works. In each area, safety is underlying issue. You always see if anything terrible is happening to anyone, anything that is not acceptable as a trade-off. And then once it's marketed, all the time when you are giving it, you go into a process of checking, surveilling side effects and getting reports all the time to see if there's anything happening. Now, this is again one major concern people have had. If it takes so long to make a vaccine, how the hell did we end up with vaccines within 1 year of a disease coming up? Which I think is a fair question and should be of concern to anybody who doesn't like dying too much. So the issue here is that there are a number of things, as I said, you can see this is what usually happens. Although here they've made 18 to 30 years, this is preclinical, this is later on. They've got all these things that they've mentioned. That's usually what happens with vaccines. And in fact, this is probably an exaggeration that number of vaccines happen this quickly. The fastest one that we actually had from trial to being on the market was the pertussis vaccine with the work of 3 amazing ladies. I like them because pertussis is my research area, whooping cough, where they managed to get a vaccine in like 4 years or so of clinical trials into the market. This happened pretty quickly, but the reason is simply this. You'll remember a few years ago, if you do, there was a time when we used to go to the airport, we used to get screened with those for SARS. SARS was one of those viruses that came through. And then there was another one called MERS, Middle Eastern Respiratory Syndrome. SARS is severe acute respiratory syndrome. You realize, so the virus that causes SARS is a coronavirus. It's called SARS-CoV. Severe acute respiratory syndrome coronavirus. That is the name of the virus. The one that causes COVID-19 is SARS-CoV-2. So these viruses are virtually identical. They are cousins, if not all, altogether siblings, really. So these are viruses that are the same. A lot, because people were afraid that SARS was going to cause a pandemic, exactly what happened now happened. People went into hyperdrive to produce vaccines to try to combat SARS. SARS was contained pretty quickly, and it was one of those times that WHO and countries worked very well together to quarantine quickly, shut down ports of entry, stop it from spreading from Southeast Asia and so forth. But all the work for the vaccine continued in the background. All these technologies were developed. All these things were put in place, but then you couldn't test the vaccines. Well, you can't test a vaccine if there's no disease going on, because you need to compare those who get the disease and those who don't. And if there's no disease, you don't know if it works because there's nothing for it to prevent. So SARS petered out, MERS petered out and died from being a pandemic. And so we never really used that technology. When COVID-19 was, the virus was detected, it took a very short time to actually just dust the technology and just use the same. So all the work that we spoke about before, all this work had already been done up to phase 2. So this, if you look at even how Moderna was developed, they basically waived the phase 2, but it makes sense. That's what we do every year. The flu vaccine is what we do every year. The technology is the same, but because the virus changes every year, you just change and put the virus that is around into the vaccine for the body to learn to fight against. But everything else in the vaccine, the recipe is the same. It's almost like you're making some kind of I don't know, almonds muffins, and now this next time you decide you're making macadamia muffins, you don't change the muffin recipe, you just put different nuts. That's basically what happened with this technology. So a lot of work had already gone in, and all that happened with these vaccines is that it cut all the 10 years before that was needed because the work had been done. What also happened too is that two coinciding things happened. One is that because governments were so scared, they put all the money to the pharmaceutical companies to help them develop vaccines. One of the most expensive things is recruiting participants, following them up, because it takes a lot of money. I mean, I'm doing a trial now, and I can tell you that even if money is not as expensive as some of these trials, it is quite costly. Now, by governments putting money into this, it offset all the risks that research and development had for companies. So they didn't have to carry the burden. What was also amazing was how many people then volunteered to actually take part in these trials. So the recruitment was so much quicker because thousands of people just volunteered to be in these trials. But because we're in the middle of a pandemic, remember, for you to know the vaccine works, you need in a group of people who were given the vaccine and this to actually see some cases occurring. Then you can separate them to see, are they occurring in those with the vaccine or in those without the vaccine? Because cases were occurring so quickly because of the pandemic and these trials being done all over the world, the answer could be reached much quicker. In fact, where some vaccines thought, the studies thought they will have an answer in 8 months, whatever it is, they got the answer in less than half the time because suddenly enough cases had occurred for them to separate the ones that got the vaccine and the ones that did not. And it was clear that these vaccines were protecting those who got the vaccine doses. So that just probably explains part of that.